obviously we know that latent infections, viral, bacterial, or any organism can trigger chronic cell stress, chronic inflammation, cell danger response. And part of the cell danger response is for a cell to not convert T4 to T3. So I talk about this all the time. Kelly and I talk about in the book, cells operate either from a low stress mode, they're in manufacturing mode, they want a high T3 to drive the manufacturing process and turn off the immune inflammatory response. If they're sensing danger, they want to decrease the amount of T3 in the cell, turn off the manufacturing process, turn off the energy production in the mitochondria, kind of turn it down and ramp up the immune inflammatory processes to protect itself. So it's not unusual that you would have hypothyroid symptoms if you have a chronic infection, because the body's reducing mitochondrial function. You're reducing the T3 binding to receptors that make proteins and enzymes and ATP and energy. And instead, you're getting activation of inflammatory mechanisms. So for sure, we look at chronic hypothyroid symptoms, regardless of what your TSH is, as an indication that there's some type of cell stress going on. So not hard to believe any organism could potentially do that. Low white blood cell count, like there's a lot of reasons you can have a low white blood cell count, but one of the most common ones is a chronic low-grade infections for sure. I mean, there could be folate deficiencies, it could be copper deficiencies, but as we said at this outset, why would they be low to begin with, right? So that would be another question we'd ask. And we'd also see other patterns for that. Maybe in the iron panel, we'd see patterns of looking at a CBC and differential. We'd be able to take a look at, are there other markers of folate deficiency? So, but typically when I see a low white blood cell count, I'm thinking, we got some type of chronic immune response going on, probably chronic infection.